talk about the anatomy of a great team, we've got to define clearly what that means and what are we trying to accomplish. You see, I'm guessing that your team and you team members, when you're equipped and trained and given everything that you need to succeed, you rise to the occasion, don't you? Most of us do. And if you like your job and you like treating patients and you like doing what you do and becoming better at it, all you really need is the tools and the direction to really take that the next step forward. So in this part of our conversation, we want to talk about the different roles in that great team. Hygienists, you are the screening rock stars. You're the ones that your patients love. They would always prefer coming into your chair than the doctor's chair. Hey doc, no offense. But patients love their hygienists. They share life with you. They spend 45 minutes to an hour with you each time they come into your practice, and they know what their copay is. There's no surprises when they sit down in your chair. So with that relationship, you can step in a little deeper to finding out if they have any airway issues, making sure that their airway is healthy and not an underlying issue for their life. When they share those struggles with you about feeling tired or not refreshed from their sleep, you can step in a little deeper as that trusted advisor and speak into their life, potentially if you see any signs or symptoms of their issue. Back office, you are the sleep champions. You're the ones that will take this process that hygiene starts in that conversation with a patient, and you will take it through the finish line. You're the ones that will make sure along the way that that patient has their hand held, they're taken care of, and they understand exactly what the next step holds. Whether it's a consult with the doctor or delivery of the oral appliance or that self-care of the appliance when they're good to go. You are the support that patient needs throughout this process. Front office, you are the closers. Yes, you are. You are the ones that help patients pay for what they want. They come to you, possibly strapped for finances, needing to find a way to get this one thing that will change their marriage, save their life, impact their morning the day after they get their appliance. You are the one that makes things happen for these patients. You hold a critical role. Don't dismiss that. Make sure you own it and have everything that you need to get those patients to that yes. And doctors, last but not least, you are the enabling leaders. When you enable your team and support them along the way, you are the foundation that they lean on anytime they need help. But don't do their job for them, empower them to do it themselves. Now, I will tell you, in each one of these roles that we've just defined, there has to be a flexibility, but structure at the same time. This framework, as we like to call it, lives and breathes very differently from practice to practice to practice across the country. You see, the way that you practice dentistry is very different than the person practicing dentistry in another state or down the street. So this framework is flexible enough. These roles can be moved around, not in the sleep champion or the screening rock star, but different people in your practice might hold different roles. I want to give a shout out to those hygienists that totally changed their doctors' minds and became the sleep champion, which is normally a back office dental assistant role. Lori in Wyoming and Jenny in Tennessee, you guys rock. Keep it up. And for those of you front office folks that have actually changed your doctor's mind on who does the screening in the practice, normally that's reserved for hygiene. Sarah in Gilbert, Arizona, and Sarah in Granville, Ohio, you guys rock. Keep it up. Your doctors are thankful, and you have helped a tremendous amount of patients. Do you, because you're crushing it. For those of the rest of you that are listening here and are waiting to get started or may have hit a couple of hurdles, keep pushing through. You've got this. Know your role. Ask your doctors for what you need, whether it's training or tools or decisions that they need to make. Ask them, tell them what you need so that you can succeed. Because at the end of every conversation, in those hurdles, those struggles, those questions, At the end of every conversation is a patient who is suffering that we can help. We got to get to that patient. So here we go. Let's do it together.